I need to start today with something that might genuinely upset you, because millions of seniors wake up every morning, walk into their bathroom, and perform a simple 2-minute routine they believe protects their heart, and that exact routine may be quietly pushing their blood pressure higher. Not salt, not weight, not stress. This is deeper than that. I'm Dr. Christina Serrati. And what I'm about to explain is something most cardiology offices still don't routinely ask about. It doesn't show up on your standard blood panel. It's not part of a typical hypertension workup. And yet, for some of you, it may be canceling out the very foods you're eating to protect your arteries. Let me tell you about Elaine. She was 74, disciplined, organized, the kind of woman who followed instructions carefully. She walked every morning before the Arizona heat set in. She ate beets, arugula, spinach. She took her medications exactly as prescribed. Her blood pressure, 164/96. Year 1, she trusted the process. Year 2, another medication was added. Year 3, the numbers were worse than when she started. And every morning, without fail, before coffee, before conversation, she rinsed with antibacterial mouthwash, 30 seconds, twice a day, like she had for 15 years. No one had ever asked her about it. Here's what most people don't know. Your body has two major systems for producing nitric oxide, the molecule. That tells your arteries to relax. One system lives inside your blood vessels. The second one, it begins on your tongue. When you eat nitrate-rich foods like beets and leafy greens, those compounds are absorbed and then concentrated into your saliva. Your salivary glands send them back onto your tongue. And here's the critical part. You cannot convert those nitrates into nitric oxide by yourself. Specific bacteria living on the back of your tongue perform that conversion. Without them, the process stops. Antibacterial mouthwash does not discriminate. It wipes out harmful bacteria and the beneficial, nitrate-reducing species along with them. Within a week of twice daily antibacterial rinsing, those helpful bacteria can be drastically reduced, meaning you could be eating all the right heart-healthy foods and chemically disabling the pathway that makes them work. Clinical research has shown that regular antibacterial mouthwash used can raise systolic blood pressure by several points in as little as 1 week. 5 points. Might not sound dramatic, but across the population, that translates into meaningful increases in stroke and cardiovascular risk. Elaine wasn't failing treatment, she was unknowingly blocking it. Before we go deeper into the next hidden mechanism affecting your arteries, I want you to pause and think. Have you been using antibacterial mouthwash daily? Because what we uncover next may explain why your arteries look normal on imaging, but your pressure refuses to come down. Asterisk. Now, I want to explain something almost no one talks about. You can have perfectly clean arteries on imaging, no major blockages, no alarming calcium score, and still have stubborn high blood pressure. This is where most seniors feel confused. I'm doing everything right, Dr. Christina. My scan was normal. So why are my numbers still high? Because the problem may not be inside the artery wall. It may be on top of it, inside. Every healthy blood vessel is a microscopic, gel-like lining called the endothelial glycocalyx. Think of it as a soft, protective forest lining the inside of your arteries. Thousands of tiny hair-like projections that do two critical jobs. First, they act as a barrier. They prevent cholesterol particles and inflammatory cells from sticking directly to the artery wall. Second, and this is the part that affects blood pressure, those tiny hairs bend when blood flows past them. That bending motion sends a mechanical signal to your artery too. Release nitric oxide and relax. It's how your arteries feel blood flow. Now here's the problem. Chronically elevated blood sugar, even levels your doctor calls borderline or slightly high, creates oxidative stress that shaves this layer down in OG. And a 1C of 5.7 or 5.8. Not diabetic, not alarming, but enough to gradually erode this protective lining. The glycocalyx thins. The hairs disappear. Your artery loses its ability to sense flow. Imaging still looks normal, but functionally, the vessel has gone blind. No signal gives. No nitric oxide gives no dilation, so your arteries stay slightly constricted all day long. This is why some seniors with perfectly normal scans still struggle with elevated beta readings. The structure is intact. The function is impaired. Now, the important question, can it be rebuilt? Yes. But this is not a take one supplement for 10 days situation. It's a reconstruction project. The glycocalyx is made from specific building blocks. Hyaluronic acid glycine prolinethes are abundant in bone broth and high-quality collagen peptides. But here's the critical step. Most people miss if refined sugar spikes continue. The new layer gets shaved off as quickly as it grows. This is not about fruit. It's not about eliminating carbohydrates completely. It's about removing refined, concentrated glucose fructose spikes from processed foods that trigger repeated oxidative damage. Repair requires removing the insult, providing the raw materials, giving the body time, months, not days. Now, I want you to notice something important. We've already identified two mechanisms: oral, bacteria disruption, glycocalyx degradation. Either one shows up on a routine blood panel, neither one is part of standard hypertension evaluation. And we're just getting started, because the third mechanism changes the conversation entirely. And it requires a single blood test that up to 1 in 5 seniors have never been offered. Asterisk, now we're moving into something far more specific, because up to 1 in 5 seniors with stubborn high blood pressure may not have essential hypertension at all. They may have a hormone problem, and it's testable. Your adrenal glands, the small glands sitting on top of your sitting. If you're a questionable ingredients, if you're using like a scanner app and it's like you're gonna like that, like that, like that time, like look at this. And we all know, I've been exploring. We've gone weak listed with caladrenal glands, the spine sitting at one lie. Kidneys produce a hormone called nesides. Produce a hormone called aldosterone. Aldosterone's job is simple. Tell the kidneys how much sodium to retain. When blood volume is low, aldosterone rises. When blood volume is adequate, aldosterone falls. In a healthy system, it's tightly regulated, but in many older adults, something changes. Tiny benign growths called microadenemas can develop in the adrenal glands. These microscopic nodules begin producing aldosterone independently. Outside of the brain's control, they don't shut off. When they should, they produce small but continuous amounts of aldosterone, 24 hours a day, and your kidneys obey. They retain sodium. They retain water. Blood volume expands, and your blood pressure climbs slowly, persistently. Here's the crucial part. Most common blood pressure medications do not block aldosterone directly. ACE inhibitors, beta blockers, calcium channel blockers, they work through different pathways. If aldosterone is the primary driver, those medications may only partially control the numbers. This condition is called subclinical primary, aldosteronism. It does not always cause low potassium. That's the old textbook presentation doctors were trained to look for. But in mild chronic cases, potassium often stays within normal range, so the red flag never appears. The test to detect this pattern is called the aldosterone-to-renin ratio, or ARR. It's a simple blood test, not invasive, not exotic, not expensive, but it is not routinely ordered in standard hypertension workups. Studies from major academic centers have found that when hypertensive patients are screened more broadly, 15 to 30% show evidence of autonomous aldosterone production. That means for many seniors labeled with resistant hypertension, the underlying driver was never evaluated. And here's what's powerful. When this mechanism is identified, treatment becomes targeted. Medications, called aldosterone antagonists, such as spironolactone or eplerenone, block the hormone at the kidney receptor. They stop the sodium retention regardless of how much aldosterone the microdenema produces when this is the true driver. Blood pressure reductions can be dramatic. I've seen patients struggle for years, only to see their numbers shift significantly within weeks once this pathway was addressed. This is not about adding more medication blindly, it's about blocking the correct signal. So if your blood pressure has remained elevated despite compliance, lifestyle changes, and multiple prescriptions, this is a conversation to bring to your physician. Ask about the aldosterone to renin ratio now. The next mechanism is something most people have never considered, and it goes back 40 or 50 years. To the air you breathed as a child. This next mechanism is uncomfortable because it isn't about something you're doing wrong today. It may be about something that happened decades ago. If you grew up in the 1950s, 60s, or 70s, you were exposed to environmental levels of lead and cadmium that are difficult to imagine today. Leaded gasoline, lead paint, industrial emissions, contaminated soil. At the time, it was normal. Your body protected you the best way it could. When heavy metals entered your bloodstream, they were pulled out of circulation and stored deep inside. Your bones locked safely into the bone matrix alongside calcium. Inactive, harmless, hidden. For decades now, fast forward, as we age, bone density declines. Osteopenia and osteoporosis accelerate bone breakdown. And when bone breaks down, it releases not only calcium, it releases stored heavy metals along with it. Lead and cadmium re-enter circulation. Lead behaves almost exactly like calcium inside the body. It slips into calcium channels within the smooth muscle cells of your arteries. But unlike calcium, lead does not participate properly in relaxation. It disrupts the contraction-relaxation cycle. Your arteries become less able to relax fully. Cadmium adds another layer of damage. It generates oxidative stress that rapidly destroys nitric oxide, sometimes within milliseconds of its production. So even if your body is trying to dilate the vessel, the signal is neutralized. Now, here's what makes this especially relevant for seniors. Studies have shown that even low-level blood lead concentrations, levels considered acceptable by older public health standards, are associated with higher blood pressure in older adults and in seniors. The source often isn't new exposure, it's endogenous release from aging bone. If you've been told you have osteopenia or osteoporosis, this becomes a meaningful piece of your cardiovascular picture. So what can be done? The goal is not detox. The goal is to slow bone resorption, the breakdown process, releasing these stored metals. Emerging research supports the combination of vitamin D3, vitamin K2, specifically MK7 form vitamin K2 activates proteins that direct calcium back into bone and help prevent vascular calcification. D3 supports calcium absorption. Together, they may reduce bone breakdown rate, meaning less metal remobilization over time. This is not an overnight change. This is a long-term strategy, but it's a mechanism that deserves attention, especially in seniors with both bone density loss and stubborn hypertension. Now we're going to move into something genetic, something that affects nearly 40% of the population, and it turns certain heart-healthy foods into a silent vascular stressor. Asterisk. Now we're going to talk about something that surprises almost every senior I explain it to, because it involves foods that were marketed for decades as protective. Fortified cereals, fortified breads, products enriched with folic acid to support heart health. On paper, it makes sense. Folate helps clear a compound in your blood called homocysteine. Elevated homocysteine is associated with vascular damage, arterial stiffness, feigned plaque formation. So food manufacturers added synthetic folic acid to processed grains. Here's the problem. About 40% of the population carries a genetic variant. That reduces their ability to convert synthetic folic acid into its active form. This gene is called MTHFR. If you carry one of its common variants, your ability to process folic acid into methylfolate can drop by 30 to 70%. And when conversion is impaired, things happen. Synthetic folic acid accumulates in the bloodstream. Homocysteine does not get cleared efficiently. Homocysteine is not benign. It directly injures the endothelial lining of blood vessels. It increases oxidative stress. It promotes inflammation, contributes to arterial stiffness. And here's the difficult part. You don't feel it happening. Homocysteine is not included in a standard metabolic panel. You can have perfectly normal labs and carry elevated homocysteine for years without knowing it. Many seniors eat fortified wheat cereal every morning thinking they're protecting their heart, when in certain genetic contexts, they may be unintentionally increasing vascular stress. Now, let me be clear. Not everyone with MTHFR variants develops high homocysteine, but when blood pressure is resistant and no clear cause has been identified. This is a reasonable mechanism to evaluate. The test is simple: a fasting homocysteine blood test. If levels are elevated, the solution is not extreme, it's specific, instead of synthetic folic acid. The body can be given the active forms directly: L-methylfolate, 5-MTHF-methylcobalamin, active B12. These bypass the impaired enzyme and support proper methylation. And one more step often overlooked. Removing fortified processed grains from the daily diet eliminates the synthetic substrate competing for conversion. This is not a dramatic lifestyle overhaul, it's precision. Now I want you to notice something. We've now identified 5 mechanisms: oral microbiome disruption, glycocalyx damage, aldosterone excess bone metal release, impaired methylation, and homocysteine buildup, each one biologically distinct, each one testable, each one addressable. And yet none of them are routinely screened in a standard 15-minute blood pressure appointment. Now, we move into something structural, something that explains why the top number keeps climbing while the bottom number stays relatively normal, and why many medications struggle to correct it. Asterisk, now we're going to talk about a pattern. C. Constantly in older adults, the systolic number, the top number, keeps rising, but the diastolic, the bottom number, stays in the 70s or low 80s. Doctors call this isolated systolic hypertension, and it becomes far more common after age 65. Most people are told it's just aging. But aging itself is not the mechanism. The mechanism is aortic stiffness, your aorta. The large artery leaving the heart is designed to act like a shock absorber. When the heart contracts, the aorta expands slightly to absorb the force of that pressure wave between beats. It recoils, helping maintain steady blood flow. That expansion and recoil requires elasticity, and the protein responsible for arterial elasticity is elastin. Elastin is maintained by an enzyme called lysyl oxidase. And lysyl oxidase has one absolute requirement: copper. Without adequate copper, elastin cannot be properly cross-linked and repaired. Over time, the aorta stiffens. When the aorta stiffens, it can no longer absorb the pressure wave from each heartbeat. The full force of contraction travels directly into the arterial system. The systolic number climbs. The diastolic number doesn't necessarily rise as much, which widens the gap between them. That widened gap is called pulse pressure, and it's a clue. Now here's where seniors unintentionally create this imbalance. Zinc. Supplements. Zinc is commonly taken for immune health or prostate support. But zinc competes aggressively with copper for absorption in the gut. Higher dose zinc supplementation, especially above 25 to 30 milligrams daily, can gradually deplete copper stores. A senior taking 40 or 50 milligrams of zinc for years may unknowingly be suppressing elastin repair. The artery stiffens, the systolic rises, and blood pressure Medications struggle because medications can relax muscle temporarily, but they cannot restore lost elasticity. This is a structural issue. Correcting copper deficiency is not instant. Elastin remodeling takes months, but restoring balance can slow further, stiffening and allow gradual improvement. This does not mean eliminating zinc entirely. It means correcting the zinc to copper ratio. Copper-rich foods include beef liver, dark chocolate, high cacao, spironolactose. Copper bisglycinate supplementation may also be considered ideally in discussion with a physician. Now we move into the final mechanism, and this one is especially important if you've been told to take calcium supplements for bone health. Because for many seniors, calcium without magnesium creates a vascular problem no one warned them about. This final mechanism is one I approach carefully because the recommendation behind it was well-intentioned. For decades, seniors were advised to take 1,000 to 1,200 mg of calcium daily to protect against osteoporosis, and bone health absolutely matters. But here's what often gets missed. Calcium is not just a bone mineral. It is also the signal that tells your arterial smooth muscle cells to contract. When calcium enters a smooth muscle cell, the vessel tightens. To relax, calcium must be pumped back out of the cell, and that pump requires magnesium. Magnesium is the counterbalance. It activates the ion channels that remove calcium from inside the cell so the artery can relax. Now, here's the issue. Many seniors, especially those on diuretics for blood pressure, are magnesium depleted. Diuretics increase urinary magnesium loss. And serum magnesium tests often look normal because the body pulls magnesium from tissues to keep blood levels stable so you can have normal lab results and depleted intracellular magnesium. Now imagine this scenario. A senior takes a high-dose calcium supplement. Calcium floods into arterial, smooth muscle cells. But magnesium-dependent pumps are insufficient. Calcium accumulates. The smooth muscle cannot fully relax. The vessel remains slightly constricted all day long. Multiply that effect across the entire vascular system. The blood pressure rises. And medications are prescribed to relax vessels that are chemically locked in contraction. This is why form matters. Magnesium oxide, the most common inexpensive form, absorbs poorly. Magnesium malate or magnesium taurate have significantly better bioavailability and intracellular penetration. For many seniors, evening magnesium supports overnight vascular relaxation, allowing morning readings to improve. But if you are on diuretics or other electrolyte-altering medications, this conversation belongs with your physician. Now let's step back. 7 mechanisms. Antibacterial mouthwash disrupting nitric oxide production. Glycocalyx erosion from blood sugar spikes, undiagnosed aldosterone excess. Heavy metal remobilization from aging bone, elevated homocysteine from impaired folate metabolism. Copper depletion leading to aortic stiffness, calcium overload with magnesium deficiency. None of these are dramatic. None require extreme intervention, but each requires specificity. If you've been told you have essential hypertension, understand what that term truly means. It does not mean there is no cause. It means the cause has not yet been identified. Your blood pressure is a signal. Signals have drivers. Drivers can be found. And when you address the right mechanism, the numbers respond, not because you tried harder, not because you restricted more, but because you finally targeted the system that was malfunctioning. I want you to bring these mechanisms into your next appointment. Ask about them, discuss them. Partner with your physician because lowering blood pressure sustainably is not about managing a number. It's about restoring physiology, and that restoration begins with understanding